everyone. This is Dr. Michael Yoon. Hopefully everyone can hear me. Can everyone hear me? Okay? All right. So this is a very unusual way that we are doing presentation, but we're trying to do kind of a combination of Zoom along with the Insight workshop as well. So I think this would be a good thing. So we're going to talk about some acupressure point. It's a partner type of acupressure workshop dealing with neck and shoulder tension. So first of all, what is acupressure? So acupressure basically works in the philosophy of Chinese medicine. In Chinese medicine, you use acupuncture and pressure point to alleviate tension and pressure off the body. There's 12 different meridians from the back of the body, the front, and the side. And these meridians flow like a river. They need to flow well so your body can actually function in a very healthy manner. Whenever these areas don't move very well, it can cause congestion, it can cause disease, it can cause stress. So we're going to be using different type of acupuncture points using a digital pressure to alleviate some of the tension that people may be experiencing in their neck and shoulder region. What are some of the causes of these dysfunction? And typically, it could be related to physical trauma, if you had an injury, car accident, bicycle accidents, or any type of sports injury. Or it could be related to life habits. Nowadays, a lot of people tend to sit in front of the computer, doing this all the time. Their body becomes deconditioned, it gets tight. Sometimes a poor diet can cause overweight, can cause some health issue as well. And thirdly, mental stress can cause a lot of muscular tension to the neck and shoulders. So if these three things are not properly managed, it can cause a compounding effect, which causes problems down the road. What I see from our clinic, a lot of people who have neck and shoulder tension could be related to muscular tension, but a lot of times it could be related to some spinal problem. So this lower image is what an ideal, perfect spine, perfect neck alignment should be. But a lot of times, due to trauma and injury, we may actually lose proper curvature, which leads to some degenerative changes, which causes impingement, muscular tension, and dysfunction. The acupressure, it's very important for someone who's actually receiving it to relax as much as possible. When the person's actually working on you and you're tensing up, it doesn't really help out. Secondly, the kneading technique is pretty important. What it means is you're not going to just keep pressing in one location. We're going to use a little bit of a small circular motion to help alleviate some tension in that area. And we do recommend about 30 circles, but you can do less, or you can do more. But 30 is kind of an average, but today we can do about 10-15 rotation, and I'm going to be showing you how it's done. And you want gentle, firm pressure, but not aggressive pressure. And you don't want that person turning red and in pain. So you want to do just enough, and you want to also talk to your partner whether or not this may be too painful. You just have to kind of have an open communication. After the acupressure is done, then we're going to go through some stretches. That's going to help out with the neck and shoulder as well, okay? So I don't want people to stress out. We'll have fun with this, and we'll work on it together. So these are 3 points that we're going to work on. GB20, SJ15, and GB21. You don't have to remember what that is. So these are actually acupuncture abbreviation like gallbladder and meridian, things like that. But what we're going to work on is 3 points. First point that we're going to work on is GB20. So the GB20, if we feel the back of the neck and we go to the right and left side, you'll feel connection is where the muscle called trapezius and the SCM kind of connect. So these are the 2 points that we want to work on. Now from here, what I want to use is I want to use my index or middle finger, okay? And then on the other side, I want to use my thumb. And then with my other hand, I want to gently kind of cup his forehead. So if I'm going to work on the right side of his neck, I want to just kind of gently apply pressure like this. Is that painful? Okay. And then on the left side, I want to use my middle and index finger to apply pressure like this. Or if you want to do 2 areas at the same time, I use the kind of a pinching maneuver and use this kind of pressure like this. Okay? Now some people say, well, I have a hard time doing it with one hand, so we can do it with 2. I can do this where if you guys can see, I can use my index and middle finger like this and use this side to apply pressure. And then on the left side, this. Or stabilize this side, apply pressure like this. Okay? So, those are the first 2 points. Now, second point I want to work on is called SJ15. That's where the shoulder blade is right here. And from here, we want to go inside. Almost, there's a muscle called rhomboid, which is the spine here, and muscle comes around like this. I want to use my thumb and use the other hand as a cupping motion and apply pressure like this. Okay, this is very good points for people who have who are using their mouse all the time, because when their arm is forward, it puts a lot of stress in this muscle. So bringing the shoulder back, support here, using the thumb, like that. Okay, same thing other side. I can use it this way, but I like using my right. So same thing, right side, applying pressure. The third point is top of the shoulder. On top of the shoulder, where the highest mark is, this is the muscle. So I'm going to use my thumb and apply kind of a digital pressure right on top. It's putting the pressure in. Now some people say I have a very weak thumb, so you can use a knuckle to apply pressure like this. And apply pressure like this. Okay, now we're going to take a pause. We're going to walk around and help you guys to see whether or not you're actually doing these points. Pressure point, acupressure point, more further away from the neck and shoulder, more from a distance. That's going to help out with neck and shoulder tension. So Ethan, you're going to grab a seat right here. The first point is called SIA. From the crease, one thumb up. So from here, what I want to do is bend the arm, crease is there, one thumb up, and that's the area that we're going to put pressure. And I'm going to use my thumb, like almost like a grabbing, applying pressure here. You feel that, Ethan? Okay. Now the second point is called SI3. Make a fist, and you'll see a crease. That area, open hand now. Use my thumb, apply pressure like this. Okay? So, now, next one is called LI12. We turn the arm over. He bends the arm. One thumb up, straighten it, right here on top. You see from his facial expression is tender. Okay? And LI4 is between the thumb and the index finger, the web of the hand. I squeeze it in between like this. Okay, what are the significance of these points? These 2 points are these points for muscles that actually does this, like a finger flexion, which is more on the inside of the chest and the front of the neck. These points are for extension, again, computer, which is more on the side and back of the neck. So if we take the pressure off his neck and shoulder, plus here, then you're getting a total stretch, total trigger point as well, okay? So let's work on that. I'm going to walk around with Devin to help you guys out, okay? Okay, across. All right, second, fingers together, stretch, and then stretch up, lean to your right, left. So these are all to open up your shoulder and chest. I find that acupressure irritation in a lot of ways is related to the spine. If the spine is not straight, it doesn't have proper nerve flow. When you don't have proper nerve flow, it puts congestion to the muscle, then it affects acupressure point. So what it is we deal with acupressure irritation, but we also deal with nerve irritation. And these nerves can be irritated when the spine starts to turn and twist. This is what I do. We try and correct this so your spine becomes better. It's a trigger point. That's when you put pressure on different parts of the body and you get referred pain. So pressure on the shoulder can cause headaches or numbness. Pressure in the lower back can cause pain down the leg. They're all connected. What are some of the solutions? We are doing number 2 right now. We're teaching you guys how to stretch, how to self-massage, improve your lifestyle. Some of you are my patients already who's done this. We did history, exam, x-ray, and you're getting treatments from me. Those of you who are guests, I have no idea what your spine looks like. So you can be stretching and exercising, but still have problem. So my suggestion is, those of you who've never had a proper checkup, you need to do this as well, okay? So this is what we offer. I'm a chiropractor. We do massage, we do acupuncture, we do laser, decompression. We have a lot of tools that we can work with. I don't know if you need any of it. But the key thing is getting a proper checkup, proper assessment is crucial. Now, who am I? I'm a chiropractor, but my background, I'm a martial artist. That's my dad. That was him when he was young. That's me flying over people. So I have martial art experience for over 44 years. So as a martial artist, I understand the body, but also I'm an educator and a doctor for over 23 years. My father's also a doctor of acupuncture as well. So we come from a background of health and wellness, and I think we are equipped to help you. So what I want to do is, I want everyone to thank you for coming today. I think it was kind of a success. I mean, it was a little confusing. But what I like to do is, the guests that are here, I like to offer a gift for you. The gift is a complete checkup. So if you're interested, I would like to talk to you whether or not this would be beneficial. Now, whether or not you need care from us, I don't know. But at least finding out what the problem is. But thank you for everyone for coming today. Hopefully this has been a good information for all of you. Thank you very much.